Hello and welcome to Empower and Protect Elder Abuse and Fraud Prevention. I'm Catherine Bursch, your MC today. I'm the Outreach Manager at Area Agency on Aging, Pasco Pinellas. And I am so pleased you're taking part in this virtual workshop. It's an annual event recognizing World Elder Abuse Awareness Day, which falls on June 15th. Each year, the area agencies on aging from across the state of Florida present this important event to help you understand and be better informed about how to recognize and prevent elder abuse. Another important topic being covered today, how to avoid being scammed and fraud prevention. In case you're not familiar with the Florida Area Agencies on Aging, we are 11 nonprofit groups with an official designation from the state of Florida. We're here to identify the needs of older adults and caregivers in our region, and we're responsible for developing plans to address those needs. Our overarching mission, to help people live safely with independence in their homes and communities. Today's program is just one of many in which we strive to empower older adults to age well. Before we begin, I'd like to cover a few housekeeping items. This session is being recorded to be posted to our websites and social media for those who could not attend. Following this program, we will email you a recording, additional resources, and info on how you can connect with your agency on aging. Please remain muted with the camera turned off. Turn on speaker view in the top right-hand corner to have a better view of the speaker. Please type any questions into the chat box. Questions will be answered once we reach the Q&A session later in the program. Due to the number of attendees, we may run into some technical difficulties. We're already experiencing a little of those this morning, but hang with us. And please be patient as we try to do our best to fix any issues. Our first speaker today is Christy Burby with I Think Financial. She's the director of the Bank Secrecy Act and fraud prevention programs there. She's served with distinction at I Think since 2006. Today, Christy will address various aspects of financial exploitation and fraud schemes. She's indeed an expert with over 3 decades of experience in the banking and credit union industry. Christy has a deep understanding of regulatory compliance, fraud prevention, and financial crime investigation techniques. Christy is recognized for her strategic oversight of anti-money laundering programs, risk assessments, and fraud detection systems. Welcome, Christy.
Good morning, and thank you for having me. Can you hear me?
Yes, we can.
Okay, perfect.
You can begin.
Perfect. Okay, so I just wanted to start out this morning. Again, thank you all for having me. I appreciate the opportunity to speak with this group. It's extremely important topics, and I'm honored to be here. I wanted to, first of all, let you all know that this information that I'm sharing is coming from the FBI, the Federal Trade Commission, and AARP. And those are 3 excellent resources for us to use when we're talking about scams and fraud for anyone, especially for our older members of society. So according to the FBI, and these are a little older numbers, but because it takes time to catch up, right? Everything's getting updated. According to the FBI, losses from scams reported by Americans ages 60 and over are up by 11% from the prior year. And we're seeing fraud criminals are stealing more than $3.4 billion from our older community. And that is just what's being reported. Imagine the numbers that have not been reported. And if we all reported them, they would definitely be increased. Another part of an important part of this is a topic right now is AI generated deepfakes. And we'll touch on that in a couple other slides in a moment. But I did want to bring this up because this is extremely important, because as we've all seen in the news, and the hot topic right now is AI. These audios and videos are nearly indistinguishable from the real content. So it's extremely important that you understand that that is out there and it is being utilized. Okay, you can go to the next slide. Um, so for the top 5 scams to watch for in 2025, this is an oldie but a goodie. The employment scams. Um, I know all of us from time to time are looking for an opportunity to make a little extra money um, during the holidays or throughout the year. But this is an extremely lucrative business for scammers as well. So what they do is they look for a phony, they put phony ads on websites such as Indeed, and or they'll send you recruitment pitches in your inbox, in your mailbox, or they'll reach out to you through social media. In some cases, the goal is just to gain your personal information. So, like always, if we're filling out an application for a new job, we give them our social security number, a copy of our driver's license, our bank account information, possibly, um, for if they're saying they're going to give us direct deposit. So sometimes they look to do that, and they're just stealing your information. In other cases, what they're doing is they are going to recruit you to get involved in a scam. And what we sometimes call that is a money mule. They'll recruit you to move money for them, or to perpetrate the fraud for them by depositing counterfeit checks, altered checks. Um, so what they'll do is they'll tell you to go open an account, and then sometimes they'll give you a financial institution's name to go to, and they'll ask you for your online banking username and sign on, or they'll mail you a check and they'll tell you, we're going to mail you this. You're going to send us back through Cash App or through another source of peer-to-peer transactions. And you're going to send the money back, and we're going to send you equipment. We're going to, to pay for the equipment that you need. Anytime someone starts to ask you to do a transaction for them for a job, 100% a scam. They're not going to send you money for you to then go and get gift cards or for you to buy your own equipment. That's 100% not going to happen. How to protect yourself? If you are being recruited, or if you applied for a job on Indeed, or if somebody's reached out to you, go to that company's website directly. See if you can contact that person directly. Are they actually hiring? Is it even a legitimate company? Also, the old adage, if it sounds too good to be true, it is. If they're saying you're going to be able to work from home and make $5,000 a month, that's not happening. So we have to be on guard, and we have to do our due diligence to know that that's just too good to be true. It's not going to actually happen. Um, During the application process, some of you it might be legitimate, but you should not provide your social security number or any financial information, any financial institution information, until you have vetted that job thoroughly and you know that it is a legitimate position. And we can go to the next slide. This is a very elaborate scam. And the term for the scam is very disturbing, but unfortunately, industry-wide through the FBI, Secret Service, law enforcement, this is what the scam has been called. It's called pig butchering scam, and it's an investment scam. These scammers are part of an elaborate organized um, crime group throughout the country, out of the country, in Asia, in China. Um, they are very elaborate. How it starts out is it can come through dating apps, it can come through social media. It could even be a small little transaction. I think we've all gotten a text before from somebody saying, "Hey, do you want to meet for brunch?" And then you text back and you say, "I don't know who this is." And they'll say, "Oh, I'm sorry. I thought this was Catherine. And I wanted to meet you guys for lunch." And then they try and start to build that conversation. The best thing to do is, if you get a text from somebody that you don't know and that it's not in your group and they're asking you about brunch, delete. If it's someone that actually knows you, they will reach out to you in a legitimate way. But what happens is on these dating sites, websites, social media sites, the conversation starts out slowly. These people are what what they're doing in these scams, they're reaching out to you in your prime. So they're reaching out to us that are turning 55, 60, 65, that have the prime retirement investment. You've put a lot of money in your retirement. And what they're doing is they're looking to take it all. And that's where the pig butchering comes in. They're looking to slaughter and take everything. And they will try to. They start out small. They groom you. They don't ask for money. They don't talk about investing for months sometimes. And then once they've talked to you and you think that you're friends with them, then they'll start saying, I appreciate your friendship. I've been investing in this cryptocurrency or in this Bitcoin. I really have a great investment opportunity. I really think that you should be, I really want to share this with you and I can teach you how to do it. And then that's where they get you. All of what they'll start sending you is they'll send you a link or they'll even make you open a Coinbase account and you'll think that it's real. And that Coinbase account is really in your name, but they'll take over that Coinbase account and then they'll start moving that money. And before you know it, your entire life savings is gone. So, and it's a gradual thing. And what they do is they have you invest some money, and then when you want that money back, they'll say, well, you need to put in a little bit more to get it back. And they may even send you $10,000 back in Bitcoin, but that's just stolen from someone else. So these investment scams are very high tech. My advice to all of our members and our clients that I talk to that start to look into investing in cryptocurrency is to make sure that they talk to their existing financial advisor prior. Don't get financial advice or investment advice from people that you barely know or that you met online or that you met through a text or that you met through a dating app. Um, what to do to make yourself safe? Be very cautious of any unsolicited investment advice, especially involving crypto. Um, Avoid sharing any of your financial information with anyone. I know we've always talked about don't talk about religion, don't talk about politics, and don't talk about your finances. So those are things that sometimes we still should probably adhere to. No one needs to know how much you have in your investments. The other big red flag, and it is 100% every time I talk to a victim, 100% of the time, it may have started from a text, it may have started on social media, or it may have started on a dating app. But these people, at some point, they will start pulling you over to start talking on WhatsApp, Telegram, Google Chat. They pull you off of that platform, and WhatsApp is a major one that they'll go to, is because those they can also control and delete the history of the conversation. So when you go back and try and go to law enforcement, your conversations are gone. If someone can't legitimately speak to you on a text message, and if they try and push you to Telegram or WhatsApp, or Google Chat, or there's a new one called Potato Chat. If somebody tries to move you off of the platform that you've originally started talking to them on, then that's another red flag to stop. If something feels off, it usually is. Here's where we're going to talk about the AI deepfakes. This is huge right now. ARP, Fraud Watch Network, has received dozens of reports of celebrity imposter scams. And I know that this sounds crazy, and I know that it sounds like you would never, people say this all the time, I would never fall for this. It happens every day, and people do unfortunately fall victim to this. We see it constantly. We've had people think that they were speaking to Reba McEntire, or that they think that they were speaking to a cellist named Hauser or Elon Musk, or they think that they talk to any celebrity. No celebrity is ever going to reach out to you and ask you for money. They're not going to reach out to you and ask you to send them gift cards. They're not going to reach out to you and say, hey, I'm going to mail you this check. Can you then wire me the money? They're never going to do that. The majority of celebrities don't even manage their own social media accounts. If a celebrity is reaching out to you, it's a scam. Um, they're not reaching out to random people, and they're certainly not reaching out to individuals to ask for funds to be transacted or ask you about your finances, or ask you to do transactions for them. But it does happen. And the next slide. This is another one that we see almost every single day at the credit union and at all financial institutions. Um, it's a tech support scam. The tech support scam is you'll be on your computer and you'll get a pop up message, or you'll get an email, and it may be from Microsoft or Apple, and it'll say you have a virus on your computer. And it's asking you to click on a link or to call a support number. What they're doing at that point is once you click on the link and once you call that number that's in that text, email, or pop up, you're not actually talking to Microsoft and you're not actually talking to Apple. They then gain remote access to your device, and they can sign into your online banking, or they have you sign into your online banking. Sometimes what they'll do is they'll see you have $20,000 in your savings account or $5,000 in your savings account. And they'll say, well, we're going to refund you $500 for this service, for this antivirus service. And what they're actually doing is they're transferring your own money, that $5,000 you have in your savings account, they move it over to your checking account. And once they put it in your checking account, you see you got an additional $5,000 in your checking account. And the person on the phone says, "Oh no, I made a huge mistake. I'm going to lose my job. I was only meant to give you $500. You have to get this money out for me and wire it back to me, or I'm going to lose my job." Um, these tech support scams, they get you into a frenzy. They keep you on the phone for hours at times. They are manipulating the conversation so much that you don't even realize how much information or how much access you've given them. And then before you know it, you're either pulling cash out to take to a Bitcoin kiosk, or you're wiring money to someone, or you're taking money out and the person says, we're going to come by and pick it up at your house. These are all tactics that these scammers use. And unfortunately, because they are very good at their job, these tech support scammers are extremely good at what they do. Um, they they make you seem that you're really speaking to someone from Apple or Microsoft, and they'll sometimes tell you when you go into the bank, especially if it's a large dollar amount that they were asking you to take out in cash. They tell you when you go into your financial institution, they'll say, don't tell them what it's for. Tell them it's for home repairs, or tell them that it's for to purchase a car. Um, so that's another red flag. The minute someone tells you to fabricate a story to give to your financial institution about a withdrawal or a transaction, that should be a trigger to you to say something's not right. I should not be lying to do something legitimate. Um, and that's where we want to make sure. I want you to understand that, all financial institutions, when you go to your financial institution, you're to make a withdrawal or you're doing a wire. I know that sometimes we ask some questions, and we it may seem intrusive, but I can guarantee you and trust you to know your financial institution in no way, shape, or form are they trying just to be nosy, or trying to get your information, or trying to be in your business to find out what you're doing. We are asking these questions to try and protect you from any financial loss, and to protect the financial institution from being involved in any scam. because when you take the cash out and you go and you put it into a Bitcoin machine, that money's gone and you're never going to see it again. That's your loss. When you wire money out of your account to someone else, that money is being wired to another money mule possibly, or it's being wired and then that gets moved somewhere else and then it gets moved to another place. So all of these places the money gets moved. This money that is being stolen from the American our all of our citizens, this money is not being used for furthering someone's education or feeding the hungry. This is going for some very nefarious reasons. It's going for human trafficking, weapons, um, terror attacks. So we don't want to be, your financial institution does not want to be a part of that. And that's why sometimes we ask you those questions. What are what are you doing with the cash? And you just know that we can't help you if we can't if you're not giving us the truth about what's going on. How to stay safe. Legitimate tech companies, they're never going to call you, email, or text you when you have a problem on your computer. Never. And pop-ups will never ask you to call or click on a link. Um, Always go to whoever your computer is with, whether it's Apple or whoever you have your antivirus software with. Go to that specific website, make contact with them directly through their website, not from someone calling you or not from an email phone number that you got. And never give remote access to someone that calls you out of the blue saying that they're for tech support. And then the next slide. So this is the last one that I wanted to go over with the group. Um, we're all seeing this. Financial institutions everywhere are seeing this. Um, all of our information, unfortunately, mine is, yours is, everybody's information is on the dark web. And not to scare everyone, because there's been multiple breaches. Different companies have data breaches. So some of our, if not all of our information is out there. And so that just means that we have to be diligent in protecting ourselves and knowing what red flags to see and making sure that we're monitoring our financial transactions and we're looking at our credit reports and we're looking at our bank statements carefully and we're signing into online banking and looking at our transactions daily. Right now, what the financial industry is seeing that we're seeing spoofing, which is social engineering calls. So you may get a phone call from what appears to be your financial institution's phone number, and they will claim that they're from the financial institution or the credit card company's fraud department. And they'll say, did you just make a $900 charge at Walmart in Charlotte, North Carolina? And you say no. Um, then what they'll start doing is they'll start asking questions or saying that we need to do things to start protecting your account. They may ask you for your username. They may ask you for your username and password. They may ask you for your debit card or your credit card number. Just know that your financial institution would never call you or text you or email you for any of that information. Never. We would never call you, a financial institution is never going to call you and ask for your username. What happens when you provide even your username? There's been times when I've spoken to victims and I'll say, did you give them your password? And they've said, no, absolutely, I've never given my password. But I'll say, did you give them your username? And they have disclosed to the scammer their username. And what happens is that scammer now uses that username and clicks forgot password, and then during the conversation the password for the online banking gets changed and now the scammer has access to your online banking. So how to stay safe to that is just know that no financial institution is ever going to initiate a call, text, or email for your PIN number, your online banking username or password, or any of those one-time passcodes that we get when we're signing in. one other thing, what we've seen recently, and I just had it actually happen this week. This exact scam occurred, and the scammer was pretending to be from the financial institution, and they told the client to they said, we need your debit card. There's a chip in it that we need to verify and clear before you can have a card again. Put your card in an envelope and put it in the mailbox, and someone from the financial institution will come and pick it up for you. No one from the financial institution is ever going to pick up that card. We don't need anything from that card. If the card has been compromised, we can remotely disable it. What happens at that point? These criminals, these thieves, they go by your house, they take that debit card, and they start using it. Um, so again, just to reiterate, no one from a financial institution is ever going to come by your house and pick up your debit card for you. No one is ever going to reach out and talk to you about, ask you for your personal information that's calling from a financial institution. And then finally, the biggest thing that I have to reiterate, and I get this from every conference that I go to regarding fraud, is please report the scams. If you don't report it, their likelihood of anyone getting caught or you getting any of your money back possibly, it's not going to happen. And the most important thing about reporting and talking about it is not to be ashamed. There is no reason that anyone who has fallen victim to a scam, any of the scams that I just talked about, or any other scam that is out there, there is no reason to be ashamed. These scams can happen, and they do happen to anyone and everyone, all ages. They get but our older society gets targeted a little bit more. But anyone can be targeted and can fall for these scams and become a victim. And you should not be ashamed. The biggest thing is to talk to law enforcement, talk to your financial institution, talk to your trusted family and your trusted friends. Um, and no one should make you feel bad for falling victim to this, because all of us are susceptible to this. And these criminals are very good at what they do. This is their occupation. They have warehouses, they have call centers, they have seniority, they have callers, supervisors, and managers. They are very good, and they do a really good job of, unfortunately, taking advantage of people. I've added some resources on here of how to file or where to file. There is an AARP has a phenomenal resource. If you have been a victim of a scam, they have phenomenal resources to talk to someone. It can be a very emotional time, it can be an embarrassing time, and they have wonderful resources. Again, I thank you all for taking the time to listen to me today.
Thanks so much, Christy. Boy, these folks are so sneaky, and we really appreciate the information you've given us today. Personally, I wish all those brunch invitations were legit, because who doesn't like a good brunch, right? And also, if you have
Definitely.
questions for Christy or any of the other speakers today, type it into the chat box and we'll get to them later in the program. Next up, our speaker is Nikki Cole. She's the training supervisor with the Florida Abuse Hotline, run by the Department of Children and Families. Nikki's worked for the state of Florida for 15 years. Most of that time has been with the hotline. As the Abuse Hotline training supervisor, Nikki's team provides community training, in-service training, and pre-service training to new hires. Over the years, Nikki has moderated many live and virtual training presentations to thousands of participants across the state of Florida. And when it comes to the hotline, she knows what she's talking about, because she's also been a hotline counselor. Today, for us, Nikki will define elder abuse, explain how to report it, and then outline the entire process that goes on after that. Nikki, you're up.
Thank you, Catherine. Good morning, everyone. Next slide. I am here to speak with you today regarding mandated reporting, the process of reporting. I'm going to start with the hotline, give you a little information about the Florida Abuse Hotline, the role of the reporter and the hotline counselor, some guidelines and information that you need to know when you need to report elder abuse or neglect. Next slide, please. So, the role of the hotline, the Florida Abuse Hotline is a central reporting center for the entire state of Florida. We are required by law to be available to the reporting public 24 hours a day, 7 days a week. Even during emergencies, we are required to be open. Even if we have to evacuate, we are here. So we're available to process reports by calls, webs, and faxes 24 hours a day, 7 days a week. We're located here at Tallahassee, Florida, at the Department of Children and Families headquarters. Next slide, please. So, your role as a reporter is very information. Who's required to report abuse and neglect? When you think about reporting abuse or neglect for elders and vulnerable adults, anyone in the state of Florida is required to report. Everyone in the state is considered a mandated reporter. This changed back in 2012. So 2012, that's when House Bill 1355 was revised. And what that statute now says is that anyone in the state of Florida who has concerns that an elder or vulnerable adult is being abused, neglected, or exploited is required to report. Okay. So it doesn't matter who the alleged perpetrator is, and that was new language that was added, no matter if it's a relative, household member, caregiver, or other person responsible for the elder, or if the elder is in fact neglecting themselves, we are required to report it to the hotline. Now, a difference between mandated reporters and mandated reporters is that professional mandated reporters are required due to their employment and their job. So those are people who work in maybe day programs, right? Assisted living facility staff, nursing staff, right? Those are people who are required by law to report. Those who work in adult welfare, elder affairs, these are people who are required by law to report. Next slide, please. So, what do you need when contacting the hotline? The most important thing that we need is an allegation of abuse, neglect, or exploitation. Okay, that is the most important thing. Sometimes people call and they will describe a situation, but we need an actual allegation of harm to an elder or vulnerable adult. I believe this person is being abused. I believe this person is being neglected. I believe this person is being exploited. And this is why. And then give us the details why. Okay. Any background information that you have. Okay. You don't have to know everything about the situation or in order to give us a call, but any background information that you can give us, how it is impacting the vulnerable adult or the elder is important. We also need a means to locate the adult. Okay. Our investigators are protective investigators. They are there to make sure that no further harm comes to that adult, right? But they are not private investigators. So they don't go out and find people. So we need a means to locate that person or those people. Okay. So that could be a home phone, right? A facility, a home address. As long as we have a means to locate, we will be able to process your report. Now, if you do not have one, don't stop that from you from contacting the hotline, because we do have ways to access different databases to find people. The names of participants, their demographics, such as date of birth and social security number, are important, but we process reports every day for unknown participants. So, as long as you can give us a description of the person, an estimated age, right? race, gender, any kind of demographics that can help the investigator to identify the person or the people, that can be very helpful. And then, last but not least, any sources, any people who are aware of the situation that it would be beneficial for the investigator to speak with can be helpful as well. But with this list, the most important thing is the actual allegation of harm. Next slide, please. Now, as a mandated reporter, what happens if you do not report abuse? So we know that any person in the state of Florida is required to report if they have a concern that an elder or vulnerable adult is being abused or neglected. There are penalties and consequences if you do not report. So those penalties are, you could be charged with a third-degree felony, serve up to 5 years in prison, and a $10,000 fine for each violation. Now, we are not saying that to make you hesitant to report, just to encourage you to report. We often we're contacted by the state attorney's office and law enforcement to look into situations where there were concerns that people did not report and they had knowledge of suspected abuse or neglect. So it's very important to report. Also, these same penalties people could be charged with them if they false report, right? So if people are using the Florida or misusing the Florida Abuse Hotline to harass someone, right? These same penalties are apply as well. Next slide, please. So, what does a hotline need to accept a report? The first thing is we need to know that adult is vulnerable. So jurisdiction gives us the authority to get involved in the situation, and then acceptance criteria gives us the authority to accept a report for investigation. So for jurisdiction, the first thing that we need is to know that that adult is vulnerable, and I'm going to define that in just a few minutes. We need to know that that alleged perpetrator meets that criteria, whether it be for abuse, neglect, or exploitation. That vulnerable adult needs to be also located in the state of Florida at the time that the hotline is contacted. So these are the criteria that we need for the Department of Children and Families to get involved in the situation. Acceptance criteria is what the Florida Abuse Hotline needs to accept a report for investigation. So we need jurisdiction, those things I just mentioned. We need a means to locate that adult in Florida, and we need an allegation of harm or maltreatment. Next slide, please. So, this is probably the most important criteria. Is the adult vulnerable? Right? Is the adult vulnerable? So, how we define a vulnerable adult, law states that they must be 18 years of age or older, and their ability to perform their activities of daily living, to provide their own care and protection, is impaired due to a long term disability dysfunction or dysfunction. Okay, so that's how we determine a vulnerable adult. So when we speak about a disability or dysfunction, we're speaking about something that's long term, that is either a physical disability, a mental disability, an emotional or sensory disability, right? They could have a traumatic brain injury. They are the qualifying developmental disabilities, which automatically qualify someone as being a vulnerable adult. Also, if the person is a recipient of SSI or SSDI, they are automatically qualified and are considered a vulnerable adult. So any of these criteria automatically, the five developmental disabilities like autism, spina bifida, cerebral palsy, so forth and so on, they are automatically qualified. If they're a recipient of SSI, SSDI, you are automatically qualified. Okay. And we're talking about something long term. Next slide, please. So, who's considered an alleged perpetrator? We take reports of abuse, neglect, and exploitation for adults, right? And it depends on the actual allegation who could be considered responsible for that harm. So if it's abuse, it can be a relative, caregiver, or household member, anyone living in the home with that adult. For neglect, it can be a caregiver, or if the vulnerable adult is not caring and taking care of themselves, it could be what we call self neglect. And then exploitation, any person in a position of trust or confidence with that adult. So anyone that trusts them, or they're in a position like someone who is financially responsible for them, right? They're in a position of trust or confidence. Or a person who knows that that adult lacks the capacity to consent, meaning they don't understand what they are agreeing to or refusing, and they don't understand the consequences of such. Next slide, please. This is how we define abuse, but the main thing that you need to know about defining abuse is we're looking for a willful act by a relative, caregiver, or household member that causes harm to that vulnerable adult or is likely to cause harm to that adult. Okay. And when we talk about harm, we're talking about physical harm, mental harm, emotional harm to that vulnerable adult. So something that causes or could likely cause harm to that vulnerable adult. But we're looking for a willful act, meaning something that is done intentionally. Next slide, please. When we talk about neglect, the person responsible either has to be a caregiver for that adult, meaning there is an agreement, whether it be verbal or written, there is an agreement for them to take care of them, right? If not, then we're looking at a situation where an adult is not able to care for themselves, and we're talking about self neglect. Now, there are some situations where there are spouses who one may be a caregiver for another, or maybe siblings live together, one is a caregiver for another, and they're no longer able to care for that vulnerable adult, maybe due to their own decline. Maybe their health is declining, their strength is declining, they're no longer able to care for themselves. In that situation, we would not say that that person is responsible. We would take a self neglect for each person if they're not able to care for themselves. So if you know people that are in need of assistance, maybe one was caring for the other, but they're no longer able, have them contact the Florida Abuse Hotline, because we are social services, and the purpose is to get out and make sure that they have the services that they need, so to ensure their safety. Next slide, please. Exploitation is probably the reason that we are contacted the most regarding vulnerable adults and elders. We're in the state of Florida. A lot of people retire here, right? They've worked their whole lives, they have resources. So we receive reports of exploitation on adults all day, every day, right? And who can be responsible for that with the department is a person, again, who stands in a position of trust and confidence with that vulnerable adult. So, and or a person who knows or should know that they lack the capacity to consent. Okay. And with exploitation, they don't have to have gained access to their resources. All they have to do is attempt, right? So endeavor to gain access, and we can accept a report. So we get calls all the time. We get information about videos. People are taking them to the bank. They are trying to get access to the account, become an assigner on their account, or withdraw money from the ATM. They are taking over their homes, their vehicles, things like that. They don't have to actually have gained access to that resource. All they have to do is attempt. There is new language too that's been written into law regarding exploitation and human trafficking. So trafficking adults for either their work, their labor, or or sexually has been written into the law regarding exploitation. So now we are able to take reports regarding exploiting vulnerable adults for their labor and for sexual purposes as well. Next slide, please. Other services provided by the hotline. So we are always looking to give referrals to other services because we are primarily concerned with those who are related to an adult, right? Those caregivers, those people that live in the home with them, facility staff, people who are responsible for their care or who are immediately surrounded by those adults. So not every situation of abuse or neglect falls into our jurisdiction. So, in that case, what we do oftentimes is we refer to services. We refer to places such as Hope, Florida, which is also through the Department of Children and Families, where they are able to actually walk the adults through the process of receiving services. So, not just giving a referral, but actually help assisting them in receiving services. We also refer a lot to Access Florida if there is need for temporary cash assistance or food assistance or healthcare, we will refer to Access Florida. Also, depending on the situation, the Elder Helpline, Elder Care, 211 is also a good resource. So there are many different resources, legal aid, consumer services in cases of fraud and things like that. So there's many different agencies that we refer to in the case that we are not able to accept a report, or if we're able to accept a report, but there are other services needed. So a lot of times people, when they think of us, they think of us just in regards to abuse or neglect, but we can also assist with other situations as well. Next slide, please. So, how do you make a report, right? The main way that we receive contact is through calling the hotline. Again, we are available 24 hours a day, 7 days a week. All you have to dial is 800 96 abuse or 800 962 2873. That is how you can reach us on the phone 24 hours a day, 7 days a week. We do have a newer feature called Callback Assist, where it will hold your space in line of the order that you called, and we will give you a call back if you do not want to wait on hold. The only thing is operable during normal business hours. We're not going to call you back late at night, right? Or in the middle of the night. And if you do miss that call, you do have to give us a call back, but you do not have to wait on hold any longer. So that is one thing. Our new web portal is helpful because you can actually sign in. It'll save your information if you set up an account, and you don't have to continue. If you have to make a lot of reports, you don't have to continue to log in and put your information all over again. It's an actual portal. You can check the status of reports, whether it was accepted or not. Anything that you've entered, you can check the status of. It's completely confidential, just like if you contact our hotline. And so we're getting more and more web reports daily, even more so sometimes than our phone calls. But our new web portal, the one of the newer features on it is that you can receive an email to find out whether or not we accepted your report for investigation. So we will email you back with the counselor's first name who processed your report and their ID number, and let you know if your information was accepted for investigation or if it was just documented in our system. And if it was just documented in our system, we'll let you know why we did not accept that report. Thank you so much for your time and your attention. I look forward to any questions that you may have a little later on in this presentation, but thank you for listening.
Thanks so much for that valuable information, Nikki. I know as an outreach manager and I'm out at events, people ask me about how to report elder abuse, and I certainly learn more about the process today. So it's important for all of us to be aware of this issue. Once again, if you have questions for Nikki or any of the speakers, enter your questions in the bottom of the screen in the Q&A section, not the chat section like I previously instructed. Go to the bottom of your screen and type in your question in the Q&A section. Our final speaker today is Amy Thomas. She's the Director of Community Care Coordination with Elder Options. Amy has dedicated her career to serving vulnerable populations. She does that through community-based organizations, focusing on direct services and administrative functions like finance, grant management, and quality improvement. Currently, she leads several programs supporting older adults, including healthy aging, mental health, care transitions, and caregiver training and support. Amy has successfully directed multiple grant projects, developed work plans, convened stakeholders, and achieved successful outcomes. She holds a bachelor's degree and a master's degree in social work from the University of Central Florida. Take it away, Amy.
Well, thank you for having me. I'm glad to be here. Today, I am here to share with you a little bit about detecting healthcare fraud and how we can know the signs, recognize them, stop the scams, and give some helpful hints on what we can do. Next slide. So, healthcare fraud is a crime. So, it's not a mistake, it's a crime. So, it hurts all of us, but particularly older adults. There are lots of different stats out there, but what we know is that healthcare billing fraud costs the US more than $100 billion each year. But what we also know is that only 1 in 10 fraud cases is reported. It's difficult to report. It's embarrassing to report. We don't like to report, but reporting can help us and help each other. And we'll talk about that in a little bit. And that fraud we know can delay care when it impacts us. If we're a victim of fraud, it makes accessing care more difficult. They can steal our identities and it can cause lots and lots of stress. So we want to do everything we can to protect ourselves. Next slide. So here's a little example. Miss Thomas is 79 years old, and she received a call from someone who said they were from a health company. They told her she qualified for a free back brace. All we need is your insurance number, they said. It sounded legitimate. She had back pain. She'd experienced it. So she thought maybe it was someone who was calling for help. But of course, time passed, weeks passed, and nothing came. No brace arrived. And she began getting mail that she didn't really understand. There were bills that were coming to her now for wheelchairs and other supplies that she never ordered and never knew about. Her insurance turned out was being charged thousands of dollars, and she was being stuck with copays. And she tried calling the people that that had called her before. Of course, it was disconnected, so wasn't able to get in touch with them. And so what turned into, all these calls and confusion and stress. And she was feeling embarrassed and violated, as we all might do when we realize that we've been a victim of a scam. And this is just one example. Next slide. So what else might it look like? How might it present itself to us? Billing for services imply and supplies that were never received, like what Ms. Thomas had. So you start getting bills, or you start seeing statements and things for things that have never come through to you, or that you never ordered or requested, or that your doctor never ordered. Sometimes it looks like charging things that are more expensive for services than what was provided. So if they start sending you bills, or you see on your statements that things that you thought you were going in for a test for blood work, and suddenly now it's tests for genetic testing and thousands of dollars are being charged, that's fraud as well. Offering free supplies in exchange for your insurance info. There are programs out there that don't cost money that are related to healthcare. However, if they're asking for your insurance info on your Medicare, or your Medicare card, or a number, or an account, or login information to your electronic health record in exchange for something, that's too good to be true. That is fraud. Using someone else's insurance. So they might steal your number, they might look for someone else's number, you might see things on your bills from your number that you didn't give to anybody. But they found a number somewhere out there on the web, then that is fraud. It's also fraudulent if someone is asking you to sign something that is blank, They're asking for your permission to do something and there's no information there, or it's unclear to you and they know that you don't understand, they're intentionally trying to confuse you. Those are other tactics that can be used in terms of healthcare fraud. Next slide. So why are older adults targeted? Well, we're seen as more trusting, less likely to report. Sometimes many folks are needing more care, have more doctor's appointments because they're taking care of their health. And so sometimes it's harder to detect because there's more frequent appointments than you might see with a young person or a child. Many older adults experience isolation, so there may be fewer people that are engaged in supporting you, and fewer people would be there to notice. And scammers are very friendly people. They are usually very friendly people. They are very good at engaging. They're very good at tempting us, as you've heard from other speakers today, to get us hooked so that we'll give them the information that they want. Next slide. So what are some steps that I could take? How can I protect myself? Well, first, you treat your insurance ID like a credit card. You're not giving your credit card information away to just anybody. Um, don't give your insurance ID away to anybody. Don't leave it for someone. Don't provide them with the number. Keep that secure, keep that private. And sometimes you don't even need to bring it in your purse or your wallet, because most often the doctor's offices and the medical facilities that you're working with usually have access to that information already. So you don't typically need to present that information. Certainly don't share any personal information with strangers. You've heard that before. So if you've got somebody that's calling you that you don't know, that's offering you a good deal on a walker, but you've never talked to them before, you never heard of them, you don't know who they are, don't engage. No reason to engage. Don't share their personal information with them. This is one that I think we can all do, is keep a journal of your healthcare visits. So keep your doctor's appointments on your calendar, whether you do that electronically, you write it in a paper calendar on your refrigerator, things like, keep track of those appointments because they're important to reference later on if you start seeing strange things coming in your mail about, oh, someone has gone to the hospital. That wasn't me. You'll have dates and available to you that you can provide when we report that. It'll help you keep track. Don't be afraid to ask questions. When anyone calls and starts asking information from you, ask questions back. Talk to your doctor, your personal doctor, about things that they might be ordering for you, because most things that are coming to you that you might need, such as equipment or tests, your physician has to have an order for, or at the very least, they're putting a note in the record about recommendations that they have for you for follow-up care. Ask them questions. What are they ordering for you? Should you expect anything? And certainly if someone calls or approaches you, don't be afraid to question them. The people that are doing the work for real understand that when you ask us questions and check our identities and our intentions, we know that we want to help protect your information. So we're not going to be offended if you're questioning us and asking us questions. And if someone presents a form to you, don't sign unclear forms. Sometimes, occasionally you go to a community event or a health fair or something like that that might have, oh, we've got some testing we can do free for you. Some of those are legitimate. You might see someone there that's taking blood pressure or sugar. However, do sign anything unless you absolutely understand or are very clear exactly what they're doing. Because what they might be doing is checking your blood pressure, but the form you signed just said that that they're going to do genetic testing on you. So we want to make sure that you understand every form. And if you need someone's assistance to explain that form to you, do that, but do that with the person you trust and not the person that might be sitting at the table trying to engage you. Next slide. So here's another example that we sometimes see. So this is an 82-year-old man. He was a mechanic. He lived alone. He was independent. You know, he kept track of his medical appointments. But one day he got a call saying that they were from a home health agency. And he said that Medicare had authorized free in-home physical therapy because of his age, not necessarily because of a condition. He didn't remember his doctor telling him about that, but the man on the phone was really friendly. He seemed professional. He used medical terms. He agreed to it, and they actually came to the house. They came to the house, had him fill out some stuff, was wearing scrubs, but he remembered later that he wasn't wearing an ID badge. But he was carrying a clipboard, so things kind of seemed real, but it was just a little bit off. So they chatted for a while, and he left, but no therapy was actually done. So it seemed a little odd again. And he was wondering where they were. And still a couple months later, it comes in. He still hadn't seen him show up, but it was being billed to his health insurance. So it was being billed. And so he saw all these entries as he was opening that up that never happened. So luckily he had his daughter that was help him report the fraud. And by reporting the fraud, when they did that, they discovered that there were other people that were being impacted by the same people in the neighborhood. So their reporting in that instance actually helped others kind of end that case. So, but this is one of those examples. It seemed right, but if it doesn't feel right, ask about it. Don't be afraid to say no and call someone that you trust. Next slide. So in those circumstances, what do I do if I suspect something's wrong? A couple of things that you could do is review your statements. So you're going to get summary statements from Medicare, or you might get something called explanation of benefits if you have some other health insurance coverage. But what they do is those are statements that come through that inventory every procedure that's being billed. And so it's important to review those statements. They can be very confusing sometimes because there's a lot of medical terminology on them. There's sometimes, I don't know if this was part of another procedure. Maybe there's a physician's name. I went to the hospital and there's a physician's name I don't recognize because there are lots of individuals involved sometimes in the hospital setting. But you go back to that list of dates, right? Go back to that list of dates for when you were in the hospital, when you went to go visit your primary care specialist, and you can start to see if things are showing up outside of those dates that you weren't expecting. Then you can call your doctor. You can talk with them about, did you order a test? Did you order equipment? Have you prescribed something? They can help you walk through that. And we'll talk about some other resources that can help you through that. But review those statements and look for something odd, particularly around dates or equipment that you don't have that are showing up on your statements. Save all those documents that you get, the phone numbers and the letters that you might be receiving them. Save those because those provide evidence and can help when we're going through and trying to figure out how we might recover from some of the fraud, or when we report to law enforcement, that they can help kind of track what's happening from the fraud or exploitation situations. The other thing to do is to call your health plan, whether it's Medicare, Medicare Advantage, or some sort of insurance that you might have. Call your health plan directly, and we'll provide some contact information for how you can do that in a moment. But call them directly and let them know. They can also help you walk through those statements. But you can let them know that there's a problem, and they will also take a look into the activities that are going on the statements that they're sending. And then we're going to talk about reporting in a minute, but reporting again is so important. You've heard this from others. It is hard to do. It's hard to admit that the mistakes are happening or that someone might be taking advantage of me. But it helps protect others in the community because we can see the trends, there are more investigations going on, and it can stop it from happening to other people. Next slide. So I talked about those different reporting mechanisms. who can you report to? So if you're a Medicare recipient, then Medicare, 1-800-Medicare. They will direct you through that process of reporting the concerns that you have or the suspicion that you have about fraud. If you have private insurance, maybe you obtained that insurance through the marketplace, the health insurance marketplace. If you did, you can call them as well. You may have Medicaid or other healthcare plans. You can also call the Health and Human Services at the 1-800-HHS-TIPS. This is on a federal level so that they know they can track where fraud is happening and take action against that. Here in Florida, you can call the Florida Attorney General's Medicaid Fraud Control Unit, and that number is provided there. They are good about tackling these situations, and their goal is to prevent fraud and exploitation of any kind. You could call the people that contract with all those Medicaid companies and oversee them. That's the Florida Agency for Healthcare Administration, and they have a specific Medicaid fraud number. But if you're not sure who to call and you need some additional help, the Elder Helpline is an excellent resource. So the Elder Helpline statewide is the 1-800-96-ELDER. You can call them and they can connect you with programs like Shine and Senior Medicare Patrol, who go through and will work with you in order to kind of dig through some of those Medicare statements and understand what your choices are with Medicare. And making sure that the services that you're receiving are legitimate. But again, keep track of those appointments, those records, keep copies of those things, any kind of mail or communication that you get, phone numbers of people that are calling you, things like that. So next slide. So to kind of wrap this up, what can I do to help others? This has happened to me. So what can I do to help others? You can share this knowledge with your friends and your family. Talking about it, again, can be difficult, but if something happens to you and it's difficult to share, but even just sharing general information, reminding folks, keep your Medicare information private. Don't share that card. If it's too good to be true, it's too good to be true. Stay alert to those red flags. I know you get lots of calls all day long from people who are saying that they're from Medicare, which they don't call, by the way, but that from Medicare, from health plans or other places that are trying to say this is free and we'll give it to you. Just give me your Medicare number. Watch out for those red flags. Look at those statements, review those statements. And again, if it is too good to be true, it probably is. But support is available. You are not alone. It happens to the best of us. So thank you.
Amy, thank you so much for your time. Really great information. And it is just sad that our seniors and really all of us are targeted like this, but this information can help protect us all. Yeah, spread the word to people about this information. Now, perhaps the most important part of our program today, your questions. Our workshop assistants will read the questions that have come in for our experts to answer. And once again, if you have questions, put them in the Q&A section at the bottom of the screen.
Good afternoon. Actually, it's almost afternoon. This is Andrea Spencer, and I'm Vice President of Communications at Elder Source here in Northeast Florida. We've got some great questions, and there is a burning one that I'm going to ask right away because something could potentially be happening as we speak. This might be for Christy or Nikki. And the reader says, or the person asks, our neighbors who are seniors are in the process of moving, and the moving company is scheduled to move them today. They have to move they have 2 large vans out there now, and the company is telling them that they need to pay an additional $1,300 before they will move them. It appears they are at a standstill. The sad thing is that the buyers of their house are ready to move in within the next 2 days. And in between that time, now they've lowered the price down to $1,200. So it's happening right now, guys. This is terrible. So Christy or Nikki, what could you advise them to do right here in the moment that they can share with their neighbors?
For me, my question would be is reaching out to the business that the moving company is with, um, and address it with the business owner or the supervisor. I don't know if it's a reputable business. Without knowing the details of it, it's hard to say, but I would definitely
Sure.
reach out to the business, and not the two people that are or the movers that are on site. And maybe reach out to whoever you dealt with um, when you set up the appointment. Um, Possibly reaching out to non-emergency law enforcement to sort it out to see if what the purpose of the additional price is. Look at the contract. What did you sign? Are there anything in there that you possibly missed? But I would definitely first step would be to reach out to the business itself, not the two people, not the individuals at the site.
That's excellent, Christy. Nikki, do you have anything to share or add? She does not. Okay. But the local law enforcement are contacting the business directly, and of course, looking at that contract. I hope this was helpful. So, Christy, this is another question for you. Do banks ever text to verify an attempted purchase in a different state? Maybe a state that you have been to before.
So I know that several years ago, financial institutions used to, whenever they saw out of pattern transactions, you were in a different state, they would reach out to you. Most of the time now, for credit cards and debit card transactions, um, if it's within the United States, they're not doing that. My advice to you, if you get a text that says, "Did you do this transaction?" and you're in Florida and it's in North Carolina, don't respond to the text. Call the number on the back of the card that the card is in reference to. Do not respond to the text. Don't respond back. Don't call any numbers that are in the text. Only call the number on the back of your debit card or your credit card.
All right, thank you. There is a comment or question in this chat that said, this is a moving company scam, not specifically targeted at seniors. The business owners are likely complicit. Local law enforcement is wise to any of a police department that handles scams generally. So this person is, again, suggesting to call local law enforcement. Okay, so thank you, Christy. Someone had asked to provide the 800 number for AARP. It is 1-866-654-5572, or of course you can go to aarp.org, and that toll-free number is up in the upper right-hand corner. And that's 1-866-654-5572. Nikki, where can we access the investigator's abuse report?
So, if a person calls and reports concerns of abuse or neglect and they want to follow up on that report, they would need to contact the local county investigations office. So, it just depends on where that report was sent. And usually that's where that adult, that vulnerable adult, was located at the time of the call. So typically it's to that local investigations county office, and we have a county office in each area. So they can contact the hotline if they need that number at 800 2873 or 800-96-ABUSE, or they can look for their local county office number, which is on our website, www.myflfamilies.com.
Thank you.
And that's the Department of Children and Families website.
Thank you. And just as a reminder, this recording and resources mentioned will be sent out to everyone in an email, probably in the next couple of days. So here's another question. Amy, I received a bill for the dates I was in the hospital, but when I questioned it to the hospital, they did not know what it was about. The company name was legit at the top of the bill, but when I called it, it was not the right number. I called the hospital and reported it to them. Should I have reported it to anyone else?
So yes, reporting into the hospital is great because they can help walk through the claims, the specific charges that are on there and what they submitted. That'll give you a little bit of initial information and data. The next people I would call is I would call your health plan, and let them know what you've discovered and question. They may ask some additional questions to help kind of dig through it. And depending on, who that health plan is, if it's Medicare, that's the Medicare number that we talked about before. Or if it's Medicaid, there are Medicaid numbers to call that can help you walk through that. And then the SHINE number that's on there, on our list, which is the Serving Health Insurance Needs of Elders, that the statewide elder helpline can connect you to the SHINE program that can probably spend some individual time with you walking through some of those things as well. So there are multiple resources, but the big ones are certainly going to be the health plan and Medicare or Medicaid, if those are how you're receiving your healthcare services from.
Amy, a quick question. What is the SHINE program?
Sure. So the SHINE program is Serving Health Insurance Needs of Elders, and they are focused on Medicare. So Medicare, they are a great resource to help you. They're an independent resource that can help you navigate your choices with Medicare and choosing a plan, and they'll walk through, provide that education for you. They can also connect you to additional resources regarding going through some of those benefits, understanding your benefits, and some other programs that you might be eligible for that are connected to Medicare. It's a great thing to call because walking through enrollment is very confusing. You get all kinds of calls, you see all kinds of advertisements. It's very difficult to know which one might be best for my personal needs. They can help provide that information to you independent of all those insurance companies and commercials.
And that is a program of the Area Agencies on Aging. So no matter where you live in the state of Florida, it's free and unbiased counseling about trained, background checked volunteers who are not allowed to hold an insurance license. So again, when we talk trusted source, those are your SHINE volunteers. All right, let's get back to some more questions. Nikki, are there any restrictions or guidelines to reporting a situation in which the vulnerable adult is at risk to themselves? The risk is not from another person, but it's due to mental health issues.
There are no restrictions. It's helpful if you can tell us how they are a threat of harm. What's the threat of harm to themselves? If you can describe what's very important and what we need to know most is how they are considered vulnerable. Right? Because you have all sorts of people with different diagnoses. It doesn't necessarily mean that they're vulnerable, but if you can tell us what they need assistance with, what activities of daily living, the things that we do on a day-to-day basis that we don't even think about, what they may need assistance with, how they're impaired, how they need help, then that can help us qualify them as a vulnerable adult, and that can help us get someone out there to make sure that they're safe.
This might be for Nikki or Christy. If we reported to the financial institution, would they report it to law enforcement?
So, if you're a victim of a scam, you have to report it to law enforcement. We can't report it for you. If you're the victim of the scam, you have to report it. We can support you. And if you want to, if you're at the financial institution, they should be able to support you. So if you want to call and have an officer come out to the financial institution and meet you there, I can't imagine any financial institution not assisting you with that. But if you're the victim, you have to report it. We do things on our side. Financial institutions all have regulatory requirement for reporting certain things, but we can't make a case or file a case for you.
Okay, Nikki, did you have anything to add?
Just that we won't contact the law enforcement for you in a case of fraud. But however, the investigator, if it's a situation where they can get involved, they will support you again in making that report to law enforcement.
Thank you. Kind of another ancillary question. If reporting is so crucial, would the victim or would the whistleblower become a victim? I don't know if that is, because you can report anonymously, is that correct?
To the Florida Abuse Hotline, you can absolutely report anonymously. Would it be a situation where the reporter would, can you repeat for me,
Yeah,
please?
it says if reporting is so crucial, why would the whistleblower become often the victim, or does the whistleblower become the victim? I think I'm
So
reading this correctly.
we're required to keep all of reporters, everyone who contacts the hotline, confidential. Their information is protected by law. We do not give out any contact information or identifying information for our reporters. That's the entire Florida Abuse Hotline, all staff, the investigators. Now, there are, if when other agencies get involved, like law enforcement, they are not bound by confidentiality. So that's something to keep in mind. But we're required by law to protect the identity of those people contacting the hotline. We even go a step further and write the concerns in a way that it cannot be determined where those allegations or concerns are coming from.
So, Nikki, another one for you. What happens when it is found that the abuse reported is false?
Okay. As long as that person who reported the abuse is reporting in good faith, which means they had a genuine concern, then there are no consequences, right? When people contact the hotline, usually they're just reporting concerns. I have a concern that this person is being abused or neglected or exploited, right? So as long as they're reporting in good faith, there are no consequences. It's just closed out, right? Where there become concerns is when people are contacting the hotline to harass someone, right? And so that's when we ask that person to contact either their state attorney's office, contact law enforcement, file a report, and then they will contact us and we will do the research on the back end to make a determination if charges need to be filed. But as a person reporting, you are protected as long as your concern is genuine.
Christy, this one might be for you. If seniors want to dispute a charge on their credit report, is there a resource that they can call or email?
Yes. So what you're going to do is you're going to reach out to whatever credit report you're looking at, whether it's Equifax, TransUnion. So if you get your free credit report, you would reach out to the credit bureau to dispute that. Again, if you need assistance, going to your financial institution, someone at your financial institution should be able to assist you. But you can also, if you go directly to the website, don't click on any other links or anything, go directly to that website of where you're getting that credit report from. And they have resources on that website about how to dispute a trade line or an inquiry.
So we're gonna send this out obviously afterward. It's Equifax, and what were the other one or two? Credit report agencies, Transamerica? Christy? Hello?
I'm sorry, I was on mute. You have
Okay.
you have Equifax, TransUnion, and Experian. So those are the three credit bureaus. So
Okay.
yes, so you would reach out to one of them to report that. Yes.
Okay, great. Let's see. I'm scrolling through. I know we're nearing the end, but we're going to try to get through all of them. What this happens to me? What if I get an email telling me that I need to pay for more computer storage?
Can I delete?
Okay.
Take your computer to a trusted tech support company, Geek Squad, someone that you trust. Go directly to a website. Do not go on any emails, any text messages. Don't respond to any of that. Delete. Do not go through any email, whether it is you. So say you bought something from Dick's Sporting Goods and you get an email saying that you got a coupon for Dick's Sporting Goods. No, go directly to Dick's Sporting Goods, put the code in there and see if the email works. Do not click on any links in any email. You never know when an email is being spoofed. Don't go through any emails. Always go directly to any service or site that you would go to directly to obtain more storage. Another thing on that, just real quick, a lot of people are getting PayPal emails right now. A ton of people are getting emails from PayPal saying that you have a charge for $630 coming out of your account. Delete, 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 delete. Don't call the number in the email. If you don't even have a PayPal account, it's fraud. If you do have a PayPal account, go directly to your account on your app or on your website and review it there. Don't respond to any emails.
And I'm going to just piggyback off of your delete, delete, delete. So when somebody calls you, hang up, hang up, hang up.
Yes,
So,
or don't answer at all. If
or
you don't
don't
know that,
answer at all.
let it
Exactly.
go to voicemail. If it is important, the
True.
person will legitimately leave you a voicemail.
Okay. Amy, is there an 800 number for Shine?
There sure is. And that what I typically tell people to do is to call the 1-800-ELDER line because they'll direct you everywhere you need to go.
And that's 1-800-ELDER. I'm drawing a blank now.
Hold on. There we go. 1-800-96-ELDER.
Thank you. 1-800-96-ELDER. Thanks.
Yeah.
All right. And what happens? This is, I think, the same question. What happens if if I report an older adult who I think isn't taking safe care of himself or herself? Do they get assigned a guardian? Are they removed from their home? That's a very difficult question. And I don't know if any of you are, Nick. So guardianship is a very long and complicated process. It's very expensive. And I think that would be maybe somewhere you would get the information, Nikki, from the Department of Children and Families, correct?
Absolutely. The investigator working on the case would, that's more of a field question. So we are the beginning of the process where it's, reported and then it's taken and worked by people in the field. So yes, I'm not able to say what will happen. Yeah, I can't say what would happen.
Okay. So a question is, is there a list of different agencies and support phone numbers that can be downloaded and distributed to everyone in our team? So we will work on that and look for that in the follow-up email. We'll give you as much as we have. And I'll ask our speakers if there's anything you can please add to this long list of resources that would be helpful. And sending that to me and to Gabrielle, that we will create the follow-up email. If an investigator discloses the identity of an individual or entity that submitted the report, to whom should this breach be reported?
On our website, we have contacts for the client relations coordinator. So they are the part of the organization that takes complaints about any DCF staff. So if you have access to which is myflfamilies.com, you would just look for, there's a map and there are different client relations coordinators, or you can contact the hotline at 800-96-ABUSE. We can give you the number to the client relations coordinator and they will investigate the situation.
So we're nearing the end. We've got two other quick little things. So going, gone. If you've got anything else that you want to ask right away, please put it in the Q&A. I work with the elderly and am disheartened at the amount of neglect in several of these senior facilities. The most neglect appears to happen during the night. How can this issue for our seniors be resolved? There needs to be stiffer penalties, and who needs to be put into place? Or what needs to be put into place, or who? I would first call the Florida Ombudsman Program. That is the agency that has the volunteers around the state that are trained to look into these kinds of allegations in licensed facilities. Does anybody else have any information about that, Nikki? Is that correct? Is there, I don't know if you know about the Florida Ombudsman Program.
We often refer to the Florida Ombudsman Program, anyone who's needing support for a person who's in long-term care.
Mhm.
So we always refer, and I believe they set them up with an advocate, right? And they will walk them through making sure that they have what they need. So I have not worked with them directly, but that is a referral that we give often.
Great. And the last question for today, and if I can ask all of our panelists to stay on the line for a few minutes while everybody else will hang up on the call. What happens if a caregiver is found to be involved in abuse? Is the home health agency held responsible as well? So it sounds like the person is talking about a paid caregiver from a home health agency. So the individual and the agency, would they be held responsible? Or how might that work? Is that a
Again, I'm
Nikki?
stepping out because this is something that happens in the field. But what we do is we do try to determine who is responsible. It sounds like, especially for abuse or neglect. Of course, it depends on w- what happened, right? What the allegation is, how severe. But of course, yes, in addition to the actual worker who is responsible, the administration can be held responsible as well. So it just depends on what happened and the severity of the abuse or neglect.
Okay, we got one last question squeaked in. I'm a private home care and companion provider. Is there a specific place where I can get additional training on elder abuse?
I can answer that one. There are several places that you can go. You can reach out to the local area agencies on aging. Each one has an abuse, neglect, and exploitation coordinator. They can help arrange and connect you with different training opportunities that may be happening in the community in which you're located. And there are often other events like this that are posted on social media sites or on the Department of Elder Affairs website is another good place to look. So you can also call the 1-800-96 Elder number I was talking about, and they would also be aware of some of the community events and can get you connected to folks locally.
Thank you. And it looks like Mickey has a very long personal question. I'm not sure. And it might be something real specific to what you need an elder law attorney for. I'm going to take your question, and if you can you send me an email and I will forward it on to somebody who can answer this question for you. And it's Andrea, ANDREA .Spencer, SPENCER at myeldersource.org. Andrea.Spencer at myeldersource.org. And I will take this question and respond to you, hopefully with some additional details that can give you some assistance. Catherine, I think it's time for you to close out.
Well, I just want to thank all of our speakers today. Boy, incredible information. I've learned a lot. I hope everybody else attending learned something as well. And if you've got some tips, spread the word, because we're all helping each other in these situations. I want to thank everyone for attending. As I mentioned, you will receive a copy of this recording, other helpful resources, and contact information for each of the area agencies on aging. Along with that information, there will also be a survey about this program. We appreciate and thank you in advance for responding to that. That's very important, so we can improve the program for next year as well. And finally, of course, if you suspect abuse, neglect, or exploitation, call the Florida Abuse Hotline, 1-800-96-ABUSE. That concludes our program, And I'm Catherine Bursch, and for all of us participating in this, we hope you have a great day.